So my name is Michelle Crump. I've been practicing since 2008. I did take a year and a half off to travel, but yeah, 2008 is when I started.
So why did you decide to take this seminar?
To help improve my technical skills with my clients. I've had a lot of clients recently that I've just been unsure of certain symptoms. There's ones that you get to know on a regular basis, like, oh, that's this because I've seen it, typical patterns. And there's clients I've had recently where I'm like, I'm not really sure. I think I know. And so I've been going back actually to my books and trying to figure out. And I thought that maybe going to a refresher course, maybe seeing different ways to do things would help me benefit my clients.
Yeah, excellent. All right, so you had an interesting story about visceral type pain that people would experience and how to recognize this as a pathology in patients, but more specifically your own personal story with it. Go ahead and tell us about that story, because I thought it was bang on for visceral symptoms.
All right, so I had an emergency appendectomy. It was actually Easter weekend 2014. I was on my way to Jasper, and I had to go back to Edmonton, so that was fun. But yeah, I had laparoscopic surgery done, which was great, and the pain recovery initially was fine. I did not respond well to morphine, but words.
It's okay. We'll edit it out. It's totally fine.
But the incision sites weren't that painful. So I stayed 2 nights in the hospital, no issues. And then my first night at home, I was so excited to lay in my bed. I went to lay down, and all of a sudden, I had immense pain in the top of my shoulders. I screamed. I called for my mom. I was staying at my mom's house because she was a nurse. And I didn't know what was going on. And she explained to me that it was my diaphragm referring up, because when you have the surgery, they pump your abdomen full of air, and it was the diaphragm referral up into my upper shoulders. And it was the worst thing I've ever experienced. I could not find any positional relief. Nothing I did, no twisting, no moving, no sitting up, no laying down would make it stop. And it was the worst part of my surgery was the visceral referral. Yeah.
And so that's one of the big things that people need to realize when a patient comes in, right? You have to understand that visceral referral is exactly that. I can't find a position that makes it feel better, right? So I thought that was kind of huge. All right. Anything else you want to add? Like, what were some of the high points of the seminar that you liked?
I loved the ability to share our own stories with our clients and interact. I find that so many seminars you have to listen to what they say, and if you want to include something, they cut you off because of time restraints, so they're just like, okay, we're off topic. We got a little off topic, of course, but it was great because it was still related to massage and our practice, and I found it was very engaging. Everybody was involved, everybody was able to say what they wanted, and to actually pull in client experiences, their own experiences, and I think it helped everybody else really understand what we were talking about, draw examples. Yeah.
Cool. And then the other thing was just talk about the timing of it, because basically how did you feel like all of a sudden, boom, it's lunchtime, all of a sudden it's the end of the day?
I was really upset we had breaks. Honestly, I wanted to skip the morning and afternoon break to just keep going, because I'm like, I don't need to eat, I'm not hungry right now, I can grab a snack, bring it in and keep going. I just wanted to keep going. And then all of a sudden it was lunchtime. I'm like, no, it's not. I don't want it to be lunchtime. I want to keep going. And then when we were done, I'm like, I'll stay late. Like, I don't have anywhere to be. Can we just keep going? Because I want to keep learning, and it's very engaging. It's not one of those stuffy classes where you're just like, oh, are we done yet? I don't like looking at. It was so fast, and I just didn't want it to be over.
Yeah. All right, cool. Okay, anything else you want to add?
Super cool.
All right, okay, excellent. Thank you very much.